Hello. In this video, we're going to discuss the paper Family Rejection as a predictor of negative health outcomes in white and Latino lesbian, gay, and bisexual young adults. This paper was written by Ryan and colleagues and published in Pediatrics Journal in 2009. The purpose of this paper is to determine if family rejection action shows sexual orientation is a predictor of current health issues in a sample of lesbian, gay, and bisexual young adults, and with these findings, make recommendations to schools, health professionals, and communities. Poor health outcomes in LGBT youth are well known. More than 3 decades of studies have shown considerable health disparities compared to their heterosexual peers. Higher level suicide attempts, sexual health risks including HIV, and symptoms of depression are some of them. Similar studies in adults LGBT show the same negative health outcome. Some of the social determinants of health identified for these outcomes are the stigmatization of sexual orientation and its impacts on social environment, health and child development, lack of social support network. Although it is well established the crucial role of the family and caregivers on a child's health and well-being, until this point, no other study focused on the influence of parents on LGBT children and adolescents. This study is part of the Family Acceptance Program, an initiative dedicated to improve physical and mental health of young LGBT and prevention of health problems in emerging adulthood. It included the population of interest, healthcare professionals, teachers, and members of the family. A sample of 224 non-Latino white and Latino adults aged 21 to 25 who were open about their sexual orientation were recruited from LGBT bars and clubs and from community and social organizations that serve LGBT population. Those who volunteered to take part in this study were submitted to interviews and a survey. The criteria included ethnicity, self-identification during adolescence, disclosure about their sexual orientation to at least one parent, and have lived with at least one parent. Presence and frequency of rejecting reactions of parents or caregivers to participants' sexual orientation when they were teenagers were assessed, recorded, and classified. Mental outcome: depression, suicide ideation, or suicide attempt at least once in the past 6 months. Substance abuse such as heavy drinking or use of illicit drugs. The negative consequences assessed were problems with the law, at work, loss of consciousness, or conflicts with family and friends. Sexual risk behavior was assessed by inquiring about number and gender of partners, frequency, use of condoms, including intercourse with HIV serodiscordant partners. Let's have a look to the results. Among non-Latino white male, 61.5% were employed, and only 40% were in school. Regarding self-identification, men identified themselves as LGBT 1 year younger than women, and about the age of disclosure, there were no difference between genders. Negative outcomes. Rates were high for depression, suicide attempt, suicidal ideation, substance use, and sexual risk behavior. More than 50% reported at least one negative health outcome, and about 40% reported at least one attempt at suicide. Latino men showed higher levels of HIV risk behavior, depression, and suicidal ideation. Family rejection. In general, men experienced more rejection than women. The higher levels were found in Latino men, and the lower in non-Latino white women. Analyzing family rejection as a predictor, those who experienced higher levels of rejection had 8.4 more chance of suicide attempts, 5.9 more chance of suffer from depression, 3.4 more chance of substance abuse, and 3.4 more chance to engage in sexual risk behavior, compared to those who suffered medium or lower level of rejection. Recommendations derived from the results are: ask LGBT youths about their parents' reactions to their sexual orientations, and refer the adolescents to the LGBT community support programs. Inform and advise parents about negative reactions and all the influence that they have on health outcomes on the children, and refer them to the LGB support programs. Now let's discuss the main aspects of the study. The aim was to identify rejecting actions to sexual orientation of young LGB as a predictor of negative health outcomes in a specific population, Latinos and non-Latinos white. The study provides documentation not to determine a causality, but to a better understanding and identification of the harbingers of health problems in LGB young adults. The results reported show strong association between rejection and mental and physical issues in LGB young adults. However, the study itself has several limitations, and the study design is amenable to criticism. The method adopted to evaluate rejection was not presented in the study, and it's not possible to assure if it's validated. A correlation between negative outcomes and rejections was only demonstrated when it happened in higher levels. Discernment of rejection is somehow subjective, and it's difficult to determine if the measurement was accurate. Have the people experienced low or medium rejection, or have they just perceived it in lower levels? One of the mental disorders mentioned in the study is depression. The disease itself is known for having multifactorial etiology and high prevalence among young and adults LGB, and none of these factors were mentioned in the study. Other social determinants of health directly implicated to poor health outcomes such as employment and working conditions, housing, finance and health service were not mentioned or didn't have an impact on the outcomes. Socioeconomic status didn't have significant effects either. Latino, gay, and bisexual men were more affected than any other group in the study. It shows that cultural aspects have an important role as a social determinant of health. The sampling in the study was rather convenient, and the authors themselves reported that it's not representative. The nature of a descriptive cross-sectional non-random sampling study is prone to selection bias and recall bias, which was also mentioned. In conclusion, the recommendations are for a specific group who was exposed to a specific reaction in a familial setting. However, other settings like schools, the same guidance can be applied.